Hello everyone, Dr. Taylor Levine from Unruh Spine Center, where today I'm going to be going over some conditions that you may not know myself as a chiropractor can help you with. I'm going to not only talk about how we can help you deal with some of these issues at home with some stretches and exercises, but I'm going to give you a glimpse of what some treatments may look like if you come into office dealing with these conditions. A condition that I often have patients come into my office for is shoulder pain. And shoulder pain can present itself in a few different ways. Some people deal with shoulder pain in the front, some people deal with shoulder pain on the side, some people deal with shoulder pain in the back. When people are dealing with these shoulder issues, it could be from a multitude of things. It could be that they're dealing with their labrum, which is something that holds this ball into the socket here. Some people can be dealing with point tenderness pain right over particular areas. These conditions, there are certain tests that we'll run or potentially images to find out what you may be dealing with, and that way we can lay out a course of treatment that suits you best. Some common conditions that you may Google and find that you may be dealing with and what we'll be able to help you diagnose is bicipital tendonitis, rotator cuff tendonitis or strains, bursitis, or dealing with some partial labral issues. Some of these conditions present in multitudes of ways, and that's why it's important that you come in and get evaluated to see what sort of care is going to be specific for your needs. So depending on what type of shoulder condition you're dealing with, it may warrant for you to get an adjustment in that area. These adjustments are to help increase some mobility in that joint structure, not only what's called the glenohumeral joint, which is that ball and socket joint, but also into this scapular region as well. So I'm going to demonstrate what those would look like. All right, let me just have you take a nice deep breath in, all the way out. Good. And one more, nice deep breath in, and all the way out. Good. Okay. These are two examples of some adjustments that can help, again, facilitate that motion into that shoulder. And depending on your condition, it may be warranted. And depending on your condition as well, it may not be warranted. That's why I highly recommend that you come in and we can diagnose your condition appropriately so that way you can get the correct treatment that's right for you. Again, I'm Dr. Taylor Levine from Unruh Spine Center. And if you're dealing with this condition, please call my office and make an appointment. We'll get you evaluated and figure out what your best course of care is. We'll talk again soon.